The FID course provides delegates with, as its name implies, a foundation in implant dentistry. And the advantage of that is it allows you to dip your toe into the world of dental implants. It allows you to get a solid basic training, and then from there you can choose what direction you want to go. Should you choose to take a very academically rigorous program, perhaps go on to do an MSc, you can use this program as credit towards that. Should you wish to take a more vocational approach and do something more mentor-based and more gradual, you can in turn do that as well. So it leaves you with many, many options in terms of how you might want to develop your implant education.
It's a fact now that whether you are actively involved in providing implant therapy or not, you're going to see implants in your daily practice, because patients will come in and they will have had implants placed elsewhere, and they might move, or they might move dentist, and now they present in front of you. And really all of us have now that responsibility that we will be able to assess and also carry out routine monitoring and maintenance of implants that already exist. So we need to be able to do that. That is part of general patient care going forward.
My feeling is that delegates at this stage are not ready for live skills. We feel that it should come a little bit later on in the program. There are lots of courses you can go off to where you're offered guaranteed place 20 implants, and in a way you've got to ask educationally, how beneficial is that to somebody to drill 20 holes in a person and stick a load of screws in? Is that educationally beneficial to you if you don't have the fundamental concepts in place? So I think there's a time and a place for live skills training, and I just don't know that it comes at this point. I think it's part of their further education when they have a solid understanding of what it is they're trying to achieve.
I would agree. I think it's so central to ITI philosophy that the patient and the benefit for the patient has got to be kept in mind. And you need to be in the right place in terms of your knowledge and in terms of the skills that you've developed before you can really start applying that to patient therapy. So this is also why we adopted originally 10 years ago the mentorship model, because we felt it was important that you built a relationship and in your own practice, so one-to-one based practice mentoring, so that you could take that forward and it could evolve and that collaboration could continue. And you could imagine that you had a mentor to begin with who might help you with your first cases, but it would grow into a mutually beneficial maybe relationship where the mentor undertook certain procedures for that mentee, and on the other hand, as the mentee evolved and progressed, they could take on more and more procedures themselves as well. So not just a kind of quick fix, I'm seeing a patient or two patients this weekend and I'm getting that done. No, you're building a relationship that can then evolve forward, and it's in your own practice. You're implementing it there in your own setting, which I'm sure is much more likely to change not just your practice, but the way you practice.
The foundation level implant course has one advantage over many other courses, and that is that there is a program director who is with you throughout the course. They offer the link between each module, and they are the person that you will get to know very well while you're doing the program. So as well as getting to know them and being able to ask them all kinds of questions about both the program itself, what's happened before, what's going to happen, they are also someone who's very experienced and will help guide the delegate to create their own personal development plan. In addition to that, we encourage all of the delegates to have a mentor, someone who's closer to home that will help them to apply what they learn on the program to their patients, and will help them to work out how it is they want to progress in their implant education.